When it comes to spine health and aging, you have to take a look at this. So when we take pictures of the spine, we see things such as facet degeneration, disc bulging, and loss of disc height over time. While it may seem concerning, it's absolutely normal, but the real question is, how do we keep a strong, healthy, and resilient spine over time? As a doctor of physical therapy, I've spent the last 10 years treating the spine, and I've seen really healthy spines, and I've seen spines that have had 4+ surgeries in them. But how do we maintain that strength and mobility of our spine? While some things are in our control and some things are out of our control, what do we need to be doing to give our spine the best shot possible at maintaining strength and mobility over time? If you want to get ahead of the curve and maintain strength and mobility over time, that's exactly what we're going to be going over today. I'm going to be going over the 5 best exercises that you can be doing to maintain strength and mobility as you age. Now we're going to be going over exactly how it should be feeling, and in the description, I'm going to go over the reps and sets that you should be doing to kind of dose it appropriately to make sure that you have change. But we're going to be going over exactly what you should be doing, exactly what it should feel like, and I'm going to give you modifications for each one. So no matter where you are in the aging process, you should be successful in completing these exercises. So spine health and longevity, that's a big topic right now. And you have experts such as Dr. Peter Attia and Dr. Kelly Starrett that are doing really good work in providing insight into maintaining these things over time. But when I work with my patients one-on-one, I'm looking at their spine and the people who are doing really well into their 70s and 80s. And when we start looking at the research, a blend of mobility and range of motion combined with strengthening tends to do very well. So that's exactly what I'm going to do with you today, is we're going to be going over strength and mobility, starting with mobility work, which is just a larger range of motion, working into the available ranges of your normal, natural spine. And then we're going to follow it up with a little bit of strengthening, but we're going to be doing it in a way that's safe and effective for the aging process to help you improve and keep that mobility over time despite those things such as disc bulges, facet degeneration, and just overall degenerative processes in the spine. So let's go over our first one here, which is called thoracic rotation, and we're going to be on our hands and knees. And remember, if you can't do this on your hands and knees, I'm going to be going over a modification here in a second. So you're going to place one arm down, nice and firm underneath your shoulder, one arm behind your head. You're going to rotate elbow to elbow and then open up. Now, what I tell my clients when we're trying to work on improving spine mobility over time, just work on your available range. Like some people can only go here to here, and that's completely fine. Like guys, just do what you can do, but motion is lotion in that spine. Remember that, motion is lotion. So the more you do, and not only in this moment, but over time, you will improve. And so working on that thoracic mobility can seem really, really stiff. Now I'm gonna go over a modification with you that if you can't do that on your hands and knees, we're gonna go over a way that you can still improve thoracic rotation without doing that. So if you can't do the hands and knees rotation, this is what you're gonna do instead. Take a foam roller, put it between your knees, you could be in a chair, and then just squeeze it. A little slight pressure in, cross your arms, and rotate side to side. Oh. And what you will notice is things will start to feel stiff right about there and then come back. You want to make sure that you're in a nice tall posture. Don't do it rotated into flexion, right? We're not trying to improve flexion right now. We're working into extension. So extend your back and rotate. Remember, your spine is meant to flex, extend, and rotate. So when we do this, we're going to be going into rotation and extension and going side to side. Now, I'll put the dosage, remember, I'll put that in the description of how many times I recommend you doing it and how many times a week. And so don't worry about that, but just get the form down. So now that we've worked into extension and rotation, guess what we're gonna work into next? Our second exercise, we're gonna dive right into flexion. And I'm trying to give you guys the exercises that are most efficient. So it's gonna be some combined movements, but we're gonna be back on the floor, bed, or table to move into our next exercise. So like I said, I've had all kinds of spines do this exercise, and I'm gonna give you a modification after I show you this. And so this is gonna be working into flexion and extension. And what we're gonna be doing is we're gonna be starting on our belly. Okay, you're going to press up until you feel some sort of pressure or tension in your lower back. You're going to press up, breathe out, and then transition to a downward dog, up like this, and push those feet into the ground, and then come back down. Okay, press up, breathe out, Transition, toes underneath you, up, butt up in the air, and go down. So that's flexion, and this is extension. So remember previously we worked on rotation. Now we're gonna be working on flexion and extension. Now, there are some people that I work with, especially after they've been on the earth for a few years, that are like, Michael, I just can't do that. And like, don't even try to have me do that. That's just not gonna work. So in those cases, the modification for this is we still are working into flexion and extension, but this time you're gonna be on your hands and knees and just dip those hips to the ground. Whew, right there, I feel some tension. And then butt back. Now that still works flexion and extension of the spine, but it's just a modification. If you can't do the other one, that's A-okay. Over time, you may be able to get to it, but what's great is that we're still working into the natural, normal range of motion and mobility of their spine. So when I see clients that combine that rotation movement with flexion extension, they are giving themselves a leg up. They're working into the available normal ranges of motion of their spine and maintaining that over time. I'm not trying to make you into a gymnast. I'm just trying to give you range of motion and mobility. And mobility is generating strength within a range. Think getting on and off the ground, think getting in and out of the car, that type of thing. Things that over time tend to get hard and that we may not think about it in our 4th and 5th decade, but as things go on, those things get more challenging. So remember I was talking about earlier is that the key to longevity is maintaining mobility, but then being able to generate strength. And these next ones, I'm gonna be giving you guys some strength. And so strengthening is good because that's what we need to get through that range of motion. But as well, people who are stronger live longer. The more muscle mass you have, the longer you will live. And so we're gonna start going over some exercises that pull on the spine and pull on the hips to help make them more pliable, but help make them more dense. And so you have less risk of fracture and injury in the future. So let's go over my first strengthening exercise, which is a side plank. So you're gonna transition on your side, foot on top of foot, elbow underneath shoulder, and lift. Now, Dr. Stuart McGill would say 10-second holds and then go back down. I would say 10 seconds is a great start, but eventually you're gonna be able to go more and more. I don't care if your feet are kind of split and you're lifting up, you're just gonna think about contracting this side's relaxed, nice level cervical spine and holding that. Now, some of my clients have had shoulder work or rotator cuff work, and maybe their hip is a little bit of a bum hip, so just bend the knees. The modification for this is just a bent knee. So bend the knees, you're gonna kind of bring your hips forward, this way, and then up, and that's gonna contract the inside here. I've had people with stenosis, disc herniations, and etc. do this. This is the coming forward and lifting up. So we're strengthening into that range that we gained earlier with rotation and flexion and extension, and then now we're strengthening around the spine. Now, when you start combining that, I promise you when you get to the end of this that you're gonna be feeling stronger and better, but you just have to stay consistent. So learn the exercise, learn what it should feel like. If you have any questions, put them underneath the description, but I'm gonna keep going here and we're gonna go over some of my favorite strengthening exercises to finish this up and giving you those 5 awesome exercises to maintain strength and mobility over time. Okay, so you're going to stand up and you're going to use a chair or a countertop or something that is sturdy that you can stand next to. I do recommend using a hand to help you first because with aging and over time and maintaining strength and mobility here, we want to get into bigger ranges. So don't try to just go into it and try to do as best as you can at first. Like just gently learn the movement and then try to go deeper into the range to get more out of it. So we're gonna do a lunge. You're gonna have 1 foot forward and 1 foot back. The bigger the split, the better, right? We lose range of motion over time, so we want to keep that range of motion. So more range of motion here, the better. Hope you guys are seeing a trend here, more gap here. If you start here, that's okay, but try to end up here. You're gonna stand tall with your body and dip. Oof. So lunge is a full body movement, and if you had to ask me what my favorite all-time exercise is, it's a lunge, because it just works so much. And so I'm bending both knees at the same time and trying to go straight to the ground, bending both knees and straight to the ground. Now, you'll start to notice a burn, and we're going to bend, and now that we're moving into strengthening, you're gonna really enjoy this. So this may make you a little sore, but it's worth it. And over time, you're gonna try to get that knee all the way to the ground because that's the end of the range of motion, and that's what's great for improving this over time. Now that may happen week 1 or week 8. It doesn't matter, it will happen eventually. I've had people with knee replacements be able to do this. So dive down into that range and come back. Woo! Now it feels really good. And remember, these exercises are pulling on the hips and spine to help generate bone density and improve mobility at the same time. Don't forget to do that other side. Nice big stagger stance and bend both knees and go straight down. It's not forward, it's down. Now that we've worked on the split stance and worked into the front and back range of motion, we're gonna go into the most functional exercise possible with a little caveat, and I know you probably haven't done this before. Let's move into the very last exercise. So for the last one here, we're gonna be using this squat wedge. As you could tell, it's a bit of a wedge. Okay, I'll put the link to this in the description, but what this helps us do is that over time we lose a little bit of mobility in our hips and knees and our ankle. But remember, we want to maintain, if not gain that in the future. So this will help us get deeper into the squat range of motion without having to compromise our form and stick our butt way out and try to bring our chest to the ground. This is gonna help us regain some of that mobility in our hips and spine. So you're gonna put this on the ground. You can see the chair is here just in case I need it for my balance. And I'm gonna put this underneath my heels. All right guys, so as you can see, I'm putting this squat wedge a little ways back from the chair. I'm going to put almost my entire foot on it. And for this, you're gonna wanna find a comfortable position, like in between, the space in between your feet can vary. So for me, I like a little wider and a little toes out. And then this is the position that you wanna be in before you do the squat. So stand on the board, it's nice and grippy so you're not gonna slip. And this is the position that we're gonna keep our feet in as we go down. Okay, so you guys saw where my feet are. I'm going to put my feet on that incline board, and what I'm going to do is go down into that squat. Woof! And what that allows me to do is to go deep into the range. So use a steady chair or a countertop and dive as far down as you can. Now, if you haven't done these before, it's okay if you just start off with 5 reps, but go slow, go deep into that range and come back up. And because I have that incline board, I'm able to go further with more range of motion into my hips and my knees and my spine. And so I'm able to dive in the bigger, deeper ranges than maybe I would have before. So going into that squat can feel a little weird the first time. It could feel like you're falling back or coming forward, but hold on to something, dive into that available range. Don't go too far to where you can't get up, but you wanna challenge yourself and give yourself some grace, but also know that this needs to be done to maintain strength and mobility over time. Now, I've only given you 5 exercises, and I promise, I cannot emphasize it enough. If you do these things regularly, not only will you have a reduction in stiffness and discomfort, but you're giving yourself the best shot possible to play with your genetics and improve strength and mobility and maintain a nice healthy spine over time. If you want to be in the top 10% in your 70s and 80s, this is what you should be doing. So we went over mobility, then we went over strength to give yourself and your spine the exact boost that you need to do to give yourself the best shot possible. So hope you guys found that stuff useful. Finish off with your squats. Remember, look at the description for the exact dosage. And if you have any questions at all, please ask them underneath the video. I will get back to them. But as always, guys, I appreciate your time. Stay healthy, keep moving, and take care of you, your body, and your spine.